Your provider has ordered the Vibrant Wellness Urine Test for mycotoxins. You'll notice the contents of the kit laid out here on the table. We'll first reference the form that's listed here. The step number 1 talks about doing exactly this, laying out all of the contents of the kit to make sure that you have all of the components. Step numbers 2 through 6 will talk about how to collect and ship the product, or ship the specimen, but I'd like to draw your attention first to the provocation protocol. Provocation basically means taking something that will draw out all of the toxins from your tissues and release it into your bloodstream so that that can be filtered through your kidneys and released through the urine. It's important to follow the instructions listed on this form with the dosing instructions to make sure that we get as accurate a result as possible. For the provocation, you will likely receive glutathione, which there is one of the examples of products that you might receive here from our office. There might be a different flavor or a different company that we provide. Again, making sure to pay attention to the dosing instructions, as this will be a preparation needed to collect this sample, which usually involves around 7 days of taking this product. So making sure that we do that, and then you can reference back to this page here. The day that you decide to collect your sample, it would probably be helpful to prepare for this the day before, where we make sure that we are fasting for a full 12 hours before we collect the urine sample, and that we are not eating or drinking 12 hours before we collect this. Step number 2 shows that this is when we're going to actually collect the sample. So we want to make sure that we look at this tag that's listed here, fill out your first and last name, as well as your date of birth, your gender, and the collection date that you collected this urine. Make sure that you fill out this tag completely and legibly, as this will be attached to this provided vial, just like so. The morning that you collect your urine, remember, we wouldn't have eaten or had anything to drink for 12 full hours before we collect this. You'll collect this on your first morning urine, where you will urinate a bit into the toilet there and then collect your urine into this cup. Doesn't really matter how much you collect in here, at least aim towards a third of this volume here, remembering that ultimately that urine will be transferred into this vial. After you have urinated, you will take this provided pipette, squeeze the bulb like so, put it into the urine, making sure not to touch the bottom of the cup, and then let go. The amount of urine that comes into this will be adequate, because you'll likely just fill and transfer. So we'll pinch, get up as much urine as we can, transfer into this vial, making sure that the tip of that pipette is inserted into the vial, and then press again to release the contents of the urine, completing until this vial is filled up to that full 15 milliliters, no more than that. You will then close this lid on nice and tight, dump the rest of this urine out into the toilet, and then dispose of both that cup and this pipette. You'll take the plastic piece covering the adhesive from this tag and then place it onto the tube, which will essentially look like so. And then this tube, which will have the label on it, I'll just insert it into the bag. You can place into this biohazard bag, close like a normal Ziploc bag, and then you will take this provided requisition that has all of your patient information details, the information from the provider who has recommended this kit, as well as the date of collection. This is one portion that you will be responsible for. Make sure that you list the date of collection that you collected this urine. The back side of this indicates what test we are ordering here, and then a note of the payment information. However, you will have paid for this test kit before you left the office that day. You can then fold this into fourths here, just like so. Insert this into the back side pocket, and then you will insert this into the provided FedEx envelope. Fold in half to take all the air out. Take off this plastic piece to expose the adhesive, and then fold in half to close that. This is a prepaid envelope. You can take this to any FedEx location. Results will likely be ready within 2 or 3 weeks. So this is the only thing that you're shipping out. This is just for your reference. After you have completed this, you can dispose of this. This is also only for your reference. After you've completed the test kit, you can dispose of that as well. Some important helpful tips here for you as you're collecting this is listed at the back underside portion of this here, indicating that the only acceptable tube and label portion is listed here on that far left-hand side, showing a nicely concentrated morning urine with no blood that's filled out nice and legible and completely with this tag. Any amount of bleeding or overfilling that might be present is not considered to be acceptable. Any dilute sample, which would be produced if you had a lot to drink right beforehand or it was not collected in the morning, which is why it's important to collect in the morning. And then anything that is insufficiently filled. So making sure that we fill it to the appropriate height. That's a concentrated morning urine. Something to note for our menstruating females is preferred that you collect this once you are completed with your menstrual cycle. However, if you do have to collect it during your menstrual cycle, urinate about halfway through and then collect your urine into the cup. Maybe even changing, if you're using a tampon or a cup, changing into a clean product right before you collect it to minimize any amount of blood that might be into that urine there. The back side of this talks about a couple different tests that are included within this same kit. However, we are only paying attention to the mycotoxins. It talks about fasting for that 12 hours because that increases the excretion of the mycotoxins that we are testing. You'll notice at the bottom hand portion, this is all talking about instructions relating to the entirety of everything that we can test through this kit. Really paying attention to reading all the instructions, of course, and then we talked about the blood portion and making sure that your urine is nicely concentrated. If you have any questions, please contact your provider.